Why do punctures often fail if the veins are clearly visible to the naked eye? When venipuncture medical personnel prefer to choose the vessels looks well, but in many cases, elevating the blood vessels, which can be punctured by visual inspection and touch, is likely to be a trap and cannot realize one-time success. For example, the blood vessels on the back of the patient's hand are clearly visible, good size, and good direction. However, under the PVF, the blood vessel is damaged, whose imaging is unclear and incoherent. In this case, the blood vessel is not suitable for puncture. As shown, this patient's blood vessels are good, without any damage, rated as level 1 by the nurse. Under the PVF, we can see the closure of the vein wall. If the venous sinus is pierced, it is generally more painful and difficult to draw blood. In addition, if the needle tip punctures the valve, it will damage the valve function and easily cause large areas of subcutaneous bleeding. On this nephrology patient, we can see many blood vessels, but feels bad. Even if the blood returns well, there is always an unexplained leakage of fluid, and the indwelling needle can only be left for 1 day at most. Under the PVF, the blood vessels of this patient are poor, with severe stenosis at many sites, and some part have even diffused. Remember to avoid puncture of such blood vessels. The blood vessels of the long-term infusion patient are thick and straight, with blue veins bursting out, which feels quite good. Under the PVF, due to long-term infusion, the blood vessel is blocked. If punctured, swelling and leakage are likely to occur, which will affect the effect of the infusion. These are common traps in blood vessel puncture, which is difficult to perform venipuncture. During operation, the medical personnel can use the PVF to detect and evaluate the status of the blood vessel. Try to avoid the traps and successfully puncture.